All right, guys, welcome back to another episode. I'm here with Joe. We're going to be talking about post-AEP, the holidays, and what agents and beneficiaries can expect. So, Joe, how you doing, man? Good? Tired?
Nah, I'm not tired.
Excited?
I'm excited. A little stuffy, but excited. I'm super happy because we actually looked at the numbers for agents, and I saw some agents that went from like this type of agent to this type of agent. And like for me, I'm like ecstatic about that. That's like really, really makes me happy to know that the agents that put in that work all year round crushed it throughout AEP.
Yeah.
Like that is my advice to agents every time. If you have a slow year, don't expect a busy AEP.
Right.
If you're busy all year round, your AEP is gonna be booming.
Yeah. And I think that's awesome. I think we're going to get into it for sure, but I know I've heard a lot of different people saying how this is going to be a tough AEP, but to see what you're seeing from your team.
Yeah, man. I've seen some agents that went from like, say, they were doing 25 to now they're doing 75 or 100.
Mm-hmm.
Come
It's
on.
a game changer come next month, for sure.
Absolutely. I'm excited to see when they get their checks.
Right.
That's what gets me excited. When they call me and they're like, I got da-da-da-da-da. I'm like, oh my God. Like, that just makes me happy.
Yeah, and you know it's always on the carriers when they pay out. So
Yeah.
Did it come in?
Yeah, did it come in? Did it come in?
That's funny. So AEP, like we're talking about, just wrapped up. The holidays are here, and for a lot of people, this is kind of like an in-between season of like AEP wrapped up, OEP is coming, downtime maybe, and for both agents and beneficiaries watching, what does this post-AEP really mean? So for like agents, you know, what are your advice for maybe this downtime? I mean, again, it is the holidays, but this downtime maybe to prep for OEP or how to maybe wrap up AEP, you know? Do you have
For agents, it's obviously enjoy the time, enjoy the break.
For sure.
But also don't disconnect completely. Make sure that your applications went through. Make sure that you're returning phone calls because there's going to be people that are calling because they have questions.
Right.
And just know that there's going to be agents that are still hungry, that are looking for opportunities to say, hey, I got you next month.
Right.
I've got you because of this and that scenario. Or your agent didn't do their job. So make sure that you're at least answering their phone calls. I'm not saying just go full blown and do activities in the community. Enjoy the time with your family, but answer your phone.
Right.
Not everyone's going to call, so it's going to be minimal amount of calls, but make sure that you're following up with your clients so that way they feel that they made the right decision.
That's good. I mean, I know of an agent, I'm not going to say who, where they did an app for a person and they thought they were starting 12/1.
Yeah.
And they thought the app went through and everything like that. They normally check up, but they got kind of caught up with AEP and they didn't follow up like they normally did. And they got a phone call. And they're like, hey, I just got a bill for like $900 because the app didn't go through the right way or something like that. And all she had to do, obviously, is just make a quick phone call. She worked it out and they were able to resolve it. But, man, I can only imagine post-AEP, you got to make sure you stay on top of those.
Absolutely. You want to stay on top of it because starting January, that first 2 to 3 weeks of January really is big on customer service. Why? Because everyone's starting with their new plan.
Right.
They want to make sure sometimes their membership card hasn't come in. Their food card might not have come in. They don't know how to use a gym membership. They might have already planned out some dentist appointments and things of that nature. So as an agent, like I said, if you can get into some of it now, so that way it eases you through the beginning of the year. So it's not as intense in that time frame.
I think you just brought up something good, which is kind of my next question about like the ID cards coming in and stuff. So over the next few weeks or, you know, post holidays, like what kind of mail should like beneficiaries be expecting or maybe kind of like messaging or notifications? And should like ID cards and welcome packets be coming in? Like when can they expect that?
Most seniors should have gotten it already. They already know they got switched. It reflects it in all the systems that they got switched. So they should have gotten their cards in the mail already by this time frame. If they haven't, it should be coming shortly.
Okay.
But if they don't have it by the 1st of January, then they should be definitely talking to their agent.
Right.
Why? Because by that time, the carriers have already had enough time to mail those cards out. Now, if I'm a senior, I'm looking out for my card. If they have a food benefit, like a food card benefit or over-the-counter benefit, make sure they receive that and activate their gym membership.
Right.
Why not? You know, it's a free membership to go to the gym. You know, at this age that we're at, we got to pay for a gym membership. They get it for free. Yeah. So take advantage of those things. Take advantage of anything that the carrier gives you, and make sure that you're following through on any documentation that they're asking for. In case they might be asking for, hey, you know, for the SSBCI benefits, you might have to make sure you go to your doctor's office as soon as possible. Schedule your appointment. Your doctor will be busy at the beginning of the year. Why? Because people are coming back. They're coming back from vacation. Their grandkids are going out of town. So perfect. Make sure you stay on top of your appointments and things of that nature. You want to make sure you go to your doctor as soon as possible if you get an SSBCI benefit. So,
Okay.
hey, I'm Joe. Comment, like, subscribe. I'm not even sure if I did that in the right order. But like, comment, subscribe on YouTube, our social media, however you follow us. Thank you for following us.
So leading into the next topic, which was the holidays. So with the holidays here, maybe you could talk to why working with your team might be really key here. I know a lot of stress can come with changing your Medicare plan and through this time. How do you encourage beneficiaries to enjoy this holiday season without worrying about their coverage? And why maybe working with your team can make that difference of peace of mind rather than stressing if it went through or stressing if did I make the right choice or am I doing the right thing by myself? And why is it important not to ignore any of the details when working this out with your team?
So I think working with our team is the best idea a senior could have. Why? Because our agents are like experienced. So they've worked with the carriers. They've worked with all the carriers, actually.
Yeah.
So they have that experience and they have those relationships already established. The difference between an experienced agent and a new agent is that new agent really doesn't have any relationships. While the experienced agent already has those relationships with the carriers. So if something didn't go through correctly, if something didn't happen, they can go lean on those relationships and say, hey, can you follow up on this?
Right.
Can you tell me what's going on? And our agents really most of them are experienced. Now we do have some new agents, but those new agents now have the extension and the help of those veteran agents. So they can say, hey, who do you have that relationship? Who do you talk to about this? And they can know who to go to.
Right.
So if you're a senior that's like saying, man, I don't feel comfortable, I'm not sure. Our team is literally here to help you year round. And when an agent goes on vacation, our back office is here to help as well. So it's not just they leave and that's it. Most of the time they're relying on us and saying, hey, can you call this person? Absolutely. Why not?
Yeah.
I'm going to do anything I can to help retain any membership that we got.
Yeah.
We got Jerry, we got Miguel, we got Chris. Everybody's here, hands on deck, just ready to work.
Yeah, I've seen that over the years where, like, I know a lot of times people are like siloed on different teams, but I see like if something comes up or not available, like you said, on vacation, I've seen you guys, oh man, I'm not available. Can I tap on you to help me with this T65 or can you help me with this appointment? We'll get each other back. However, so I think you guys work really, really well with that.
Because I think teamwork makes the dream work, and that's a reality.
Yeah.
For me, I've always felt like in this industry, everyone competes, but even though everyone competes, there's enough in this industry for everybody. And that you don't have to make enemies everywhere you go.
Right.
You can just be friendly and polite and just talk to everybody. Yeah. That's how I've built Quantum, was basically by building relationships with everybody. Whether you are on my team or not, it doesn't affect me.
Yeah.
Now, obviously, we compete over numbers.
For sure.
But that's okay.
That's healthy competition.
That is healthy competition. But, it doesn't mean I've got to be a jerk to anybody.
Right.
My goal is to be as polite and as nice to everybody, treat them as if Jesus would. But at the end of the day, we're here to work.
Yeah.
That's it.
Yeah.
And so not everybody's made for you. Just understanding that is enough to say, okay, cool, I get that.
Yeah.
We've got all different personalities, so I'm okay.
That's awesome. If for beneficiaries who are watching, if they feel like something's off with their plan, what should they do?
If for beneficiaries who are watching, what I would say is that if something's off, call your agent. First things first, call your agent. And they'll guide you towards the right direction. They'll let you know whether they can do something or whether you have to do something. Because there's some things that the agent can't do. Because the carrier needs you to call directly to them to inform them of whatever changes might have happened.
Yeah.
So, but first things first, talk to your agent. They can guide you in the correct direction.
And would that lead into OEP?
That would definitely lead into OEP, yes.
For people who don't know, can you break down OEP?
OEP is the open enrollment period. That's just an opportunity to make a change if you messed up on your decision or didn't make a decision. and say you switched the plan and it didn't work out for you. That's okay. You have one opportunity. Yeah. Or you didn't make a change and you're saying, I should have made a change. Fantastic. Call your agent and they'll definitely take care of you.
That's
help
awesome.
You find the right plan.
So I know you kind of touched on that you have new agents on the team. Maybe you'll hear about it maybe after AEP. But what should new agents, maybe what tips do you have for new agents to avoid burnout from like the overwhelming, trying to learn this whole thing and chase after every opportunity during their first AEP, which can be intense, especially this one. Do you have any tips to avoid burnout next year?
For me, if you're a new agent, my tip to you is don't get contracted with every carrier. Don't try to do every part of the business. Don't go into Medicare, ACA, life, annuities, supplement plans, all these different things. Sometimes it's just too much. You get overwhelmed. You're not sure where to direct. So for us, when we train agents, let's train them on the top 5 carriers that we sell. We'll add more as you become more experienced. Let's learn Medicare well. Then let's learn ACA well. Then let's go into the next one as well. But let's not go into the rush mode where we have to have every contract into an agent, and then that agent doesn't know what to do. They just like, I don't know my right from my left. I just know a lot of information, but I don't know how to put it together. So for me, it's just basically saying, cool, let's get you on the Medicare boat. Let's get you with 5 carriers or 4. The top 5 or 4 plans in the market where we see that 80% of the sales go to. Great. If you get one of those 20%, then we can train you on that 20%. Right. We can get you onboarded as quickly as possible with that 20. But we're going to attack the 80-20 rule. And let's just do that well.
I know you guys have like a lot of different services you provide, like you said, Medicare, ACA, life, annuities, all that. But I've seen it before too, where you guys have certain people who do all of it, and they're probably super seasoned. And you have some people who just do maybe just Medicare, but it's not that one is better than the other. It's just that you guys are developing when the time is right.
That's correct. Yeah. That's all we're trying to do is figure out what's right for the person, because, to say that everyone falls into the same wave, no, because everyone's got different lifestyles. Right. Some agents here work full-time. There's other ones that are kind of part-time. There's other ones that are saying, hey, I would love to give it full-time, but I can't. I have kids, I financially can't, whatever reason it is. So we're always trying to figure that out. But we've taken advantage of this period. And we've had like some trainings with specific agents that are new. And we're saying, okay, there's only 4 of us in the room. This is perfect. Right. Let's talk specifically about the ins and out of Medicare. Let's talk about the specifics on how an appointment flow goes. What kind of questions to ask. Why this question leads to this. Why this response gets this. We're going into those type of specifics with those agents because there's only 4 of us in a room. And
even at that, I mean, you guys are across almost all 50 states. So it doesn't necessarily mean in the building because you work with people across the country.
So it could be through Zoom or whatever. But for us, we were lucky to have those 4 agents that were all here. So when you're here in the room, there's something different about it. Cool. When you're on a Zoom, it's kind of like, Actually, we've been looking for some type of technology to make it feel like, even if you're in a Zoom, you feel like you're in the room.
Okay.
Like a type of system. I've seen some stuff that actually does that well.
That's cool.
Yeah, so we'll see.
That's cool. Leads to. Well, maybe that's getting into my next question. What exciting things does maybe Quantum have coming for this New Year's, or maybe goals or expectations you might have for you and the team?
For us, our goal is to always be recruiting. That is truthfully one of our goals, is to always be recruiting. But it's not just to recruit and just to throw numbers at a board. It's also about recruiting and trying to help as many people as we can. Making sure that we're giving them the time that they need. We want to make sure that we elevate our agents to the next level, and we just want to find the right agents. So to find those right agents, we have to be recruiting year round. We have really big goals that we want to hit. For me, that first number is 25,000 lives helped. I have an ultimate goal that I'm like, I love that goal. But I want to be able to say, we help 25,000 families. And the other thing is also the way the industry is shaping now, it feels like our agents have to be prepared to take care of that person throughout their life. Whereas basically we're going to address their healthcare before they turn 65. Once they turn 65, And then part of it is also to guide them through their wealth as well. So it feels like as agents that we have to take care of almost every facet of their life.
I remember you saying kind of along those lines, like when somebody's like learning Medicare, a lot of times people don't take advantage and learn the other aspects that connect to it, kind of like what you're talking about now. And one tip you always advised was like learn Medicaid too.
Yeah.
So that way you can be a resource in that area, not just signing them up and then letting them figure it out.
Yeah. So for us, that was part of our training that we had yesterday, that we were talking to the agents. We were saying, hey, you know, when you go to somebody's house, they're going to expect you to be kind of like an expert on Social Security as well. So you have to have at least the foundations of Social Security to understand that part where you're saying, cool, if you retire at 62, this is what you get from Social Security. If you retire at 65, this is how much you could get if you retire at 67. And these are the penalties that you could pay if you go over the income limits. So we went over the specifics and the basics on it, so that way the agents could feel that they were comfortable in it.
Yeah. I've worked with various agencies, and I've seen other agencies talk about this exact scenario, and they don't want to like talk to Medicare or Social Security because they're like, I don't get paid for that. And then you have agents like, shout out to my wife, Marlene, who I've seen on an hour-long call where she has the member, Social Security, and Medicaid, and she's getting them all to talk to each other because she knows like, hey, this is going to benefit the senior, and you're going to obviously solidify that relationship.
Absolutely. And then the other thing is when you help one senior like that, what do they tell their friends?
Yeah.
Like, yo, I've got the best agent in the world. They helped me through this and this and this scenario. They sat on the phone with me for an hour with all this stuff. That's going to lead to endless amount of leads.
Right.
You know, the one thing that I've always been proud about in my career as a Medicare agent is that I haven't sold really in the last, or actively sold in the last like 4 years, or say 5. And I'm still getting leads.
Really?
I still get leads to this day from people calling, saying, hey, Joe, can you help me out with this? Can you help me out with that?
That's awesome.
Yeah.
Yeah. That speaks volumes about the mark you left.
Yeah. So I feel I'm proud of that part. I am really proud about that.
Yeah, I think that makes a difference between, like we said before, like a salesperson and a partner, like a health advisor. Yeah. So if you could leave both beneficiaries and agents with maybe one message going into the holidays, what would it be?
Merry Christmas. That's my message to everybody.
Not happy holidays?
No. Merry Christmas and a Happy New Year.
We back. Okay. If you're a beneficiary and have questions or something doesn't feel right, who should they call? And what's the phone number? And where to find you?
For us, if you have any questions, your best thing, call your agent first. You know, shout out to all the good agents out there, because there's a lot of good agents.
Regardless of team.
Doesn't matter what team they're on. There are a lot of good agents. I've walked around. I've met a lot of people that they care about the senior and stuff like that. So, you know, if you have one of those good agents, call your agent first. Now, if you don't have a good agent, or you don't feel like your agent's working on your behalf, give us a call, 407-462-7199. We would love to help. You know, we're here to help, even if you're not even our client sometimes. We just love to earn your business and your trust. And if you can refer any family or friends, we'll work off of that, but there's never a charge for what we do.
Yeah. And if you're an agent looking for a solid team?
If you're an agent looking for a solid team, you can call us or text us. We're all about family, growth, and support. That's our main thing, is to serve, educate, and elevate. We're here year round. You know, most people are asking me, you taking any vacation? No, not really. You know, I'm going to take the holidays off, but in between those days, I'm going to be here to work. There's always going to be somebody here to support the agents. There's always going to be somebody that's going to be around. I'm here all the time just to make sure that the agents feel the support, whether it's by phone call or if they come in person. We've had agents that come on vacation and they still stop by here when they come on vacation. Awesome. Just want to say hi. And I always appreciate that. So we're always here to support.
All right, awesome, man. Thank you, Joe. I think this was a really good one. And Merry Christmas. Happy holidays.
Feliz Navidad.